Today on 21st Century Business, explore state-of-the-art technology, innovative business strategies, insights from cutting-edge corporations around the globe, a visionary look into the answers of tomorrow, today. Business leaders, business solutions, 21st Century Business.
Technology gives us access to endless amounts of data. The trick is to cut through and find meaning in that big data. Today's healthcare entities don't need analytics that just sort and count, but that continuously learn and discover patterns to reveal actionable connections. Here to explain is Christopher Burgess, Chief Operating Officer and Chief Security Officer of Atigeo. Welcome, Christopher.
Thank you for having me.
Christopher, how significant is that to healthcare organizations, that ability to learn and discover patterns hidden in big data?
It's tremendously significant because healthcare is one of the key areas of the world that affects you, myself, everyone on the planet has a need for healthcare, and the advancing of healthcare is predicated on understanding the data. In the United States, we're moving to electronic medical records. The level of medical research that's available in the United States today is tremendous. When you marry that with the medical research around the globe, you're going to be able to cascade and move quickly, kind of like a waterfall effect, data being married together, even though they come from disparate sets. So the ability to channel that in a manner in which patterns are revealed, we believe, is the key to advancing medical care as well as medical research in the future.
Wow, very exciting. Tell us who Atigeo is and what you're actually providing.
Atigeo is a big data analytics company. We have been in business for approximately 7 years. We have our XPatterns platform that is based on patented technology. That platform is a semantic search engine, and within it we revealed relevance, inference, we classify information, and it's a machine learning tool as well. So the more you use it, the smarter it gets. And with that capability, we can use it across any number of industries, not just healthcare.
Wow. Well, let's learn more about Atigeo's intelligent analytics in this 21st Century Business Field Report.
Accurately analyzing big data can be extremely difficult. Successful businesses require tools which continuously learn and reveal actionable and unforeseen connections, while adroitly moving between the legacy data which may reside in highly organized silos to unstructured data being generated in real time.
The opportunity with big data, as Google and Facebook have demonstrated, is that we're now able to store and process tremendous amount of data at an unprecedented rate of growth on all types of data. And the idea that every enterprise can now perform data-driven decision-making on all of their disparate data in real time is a dream come true for businesses.
Atigeo's XPatterns platform is capable of providing the required level of analytic support and visibility into data, both structured and unstructured. XPatterns is designed to solve the unstructured data relevance problem, applying analytics to large sets of unstructured text documents, such as PubMed, by assigning relevant scores and generating domain concepts.
We deal with unstructured and structured data in its native state, and XPatterns is a novel and revolutionary semantic platform. Other sectors, including healthcare, would be energy, information security, retail, consumer, social networks. Those would be sectors that come to the forefront based on consumer interest.
Atigeo's robust software developers kit allows data scientists to easily plug and play to experiment with the best of class tools. The XPatterns platform continues to improve through machine learning of users' interaction with the documents. Atigeo's XPatterns provides the application framework for building enterprise-grade intelligent big data applications.
Christopher, how did Atigeo come to be?
Atigeo came to be, the ideation occurred with our founder and CEO, Michael Sandoval, out of personal tragedy in his life. His wife had been diagnosed with terminal cancer.
Oh, wow.
And while the best oncologists in the world were treating her, and the level of medical research pursuing the cure was present, the marrying up of the world's research specific to the cancer being treated just wasn't occurring.
Wow.
And it was in this void of knowing information was available, but because it was in disparate silos and couldn't be married together, the ideation occurred that as he was going through trying to find the research that might save her life,
Wow.
he was the one doing the research. The medical community, the practitioners, the oncologists, they're seeing X number of patients a day. They have time to do research, but do they have time to bring together all of the available research to help them in that clinical decision support or to help them in the diagnosis? And it just wasn't present. And so instead of going out there and looking for answers to your questions, the ideation was, I can create a technology to display patterns in information so that it shows me what I don't know, not reaffirms what I already know.
Wow. So he developed something called XPatterns.
XPatterns.
What is that?
XPatterns is a semantic search platform that uses natural language processing as well as machine learning to take data from any source, be it medical, research, individual experiences, you name it, melds it together in a data agnostic, linguistically agnostic manner, and produces actionable information so it can be used for business intelligence reason, it can be used for decision support. Because here we are in 2012, in the front end of the 21st century, and big data is the natural resource of the 21st century. And we believe XPatterns will be the door and the entry point for everyone to be able to use large data sets in a manner in which has never before been experienced.
And so you have a big enough database then that the information
It
that's
is big
gained,
data.
It's huge, but you can see where that would be so much
Absolutely.
more applicable than a small little subset.
Absolutely. Size does not matter with us. For example, you can take a large public database from the Centers for Disease Control or for the National Institutes of Health and process it into, take that and process it into a corpus, and then another corpus of information, process that, and then marry these two corpora together, and it creates a unique view into data, and thus the relationship between concepts across disparate data sets is availed, and that's what XPatterns does.
That is amazing. Why healthcare, Christopher, and who would your customers be?
We chose healthcare first, even though we're agnostic and can go horizontal into any sector, because number one, we're a compassionate technology company. We're turning science into products and services for a wiser planet. That's our mantra. That's our marching orders.
Wow.
That's why we exist. Healthcare is where we can make the biggest difference immediately. There are no exceptions on the planet. All of us need healthcare. It also is one where we think the biggest impact in our society can be made. So who would our customers be in healthcare? Well, you have the medical researcher. Clearly, those who are developing the newest cures or the pharmaceuticals for us would like the ability to bring together all available information so that they can advance their science in a more rapid fashion. In our tests that we did with a few clients, we saw that in a matter of seconds, when they put their data together and we processed it, and then we were doing our processing, we were able to show revelations that they tell us took a number of years to reveal, that we were showing in seconds because we were able to marry the disparate data. So the medical researcher and the pharmaceutical community, they're going to be a benefactor. Next benefactor will be the medical practitioner, be it the country doctor or the medical practitioner within the largest medical system. They will be able to use our technology to help with clinical decision support, to help with clinical analytics support, to help with the processing of electronic medical records in such a manner that they are coded correctly, and thus in coding correctly, the uplift is to the individual patient so that your medical record is correct all the time.
That would be good.
That is always good. You know, I don't know about you, but when I receive an EOB, explanation of benefits, and it has an incorrect coding in there, I lose confidence in the medical facility that provided me the service, and I also question the doctor's office saying, you didn't treat me for this. Why did you say you did?
Exactly.
And what else? I want to see my record immediately.
Right. What else did you miss?
Exactly. But I think the most important customer will be you, the individual, because we are going to be creating applications that the individual can look at, can help them understand their medical situation, can avail to them the exact same data that we can avail to the medical researcher in an empirical manner, not in a subjective manner, so that they're looking at finished research as published by the medical journals. These are all available in publicly available databases, but they've never been married together, and we're in the process of doing that now.
Interesting. So an average person, rather than just going to the internet and
You'd
finding a
go
lot
in
of
and look
random
up
stuff.
tonsillitis, and it would give you the latest science around tonsillitis, as opposed to just throwing it out there in a random search engine, and you get everybody's opinion about tonsillitis, only some of them who are medical professionals.
Right, exactly, exactly. Tell us about your computer-assisted coding tool. You mentioned coding before.
I did, and the computer-assisted coding tool is our very first product out of the wheelhouse that we're launching here. And we're very excited about it because what it will do is, using natural language processing and machine learning, is take these electronic medical records in their natural state, process it with our XPatterns engine, drawing out the information and the concepts, then marrying it to these other domain experts that we've created for CPT, HCPCS, ICD-9, ICD-10, these different coding sets, so that we do the coding automatically and we present it to the coder. And what we believe this will do is it will take the coder, who now is digesting medical records, and in the digestion of medical records, they're having to choose the ICD-9 code, which one is the most correct. They choose the code, then they process it. It's a manual process. What we're doing is we're presenting the finished code. Now the coder becomes a validator. They're validating what the machine tells them. We get a higher degree of consistency. You get a higher degree of accuracy because you still maintain that human touch. You must have that human touch, in our opinion. You also get to make sure that nothing is missed. And so what it ends up is, it's a win for everybody, because you reduce the instances of undercoding or miscodings. You also, in doing so, reduce the number of rejected claims from the payer side of the equation because it's more accurate.
Right.
And in reducing the number of rejections, you're improving your accounts receivable, and thus you're reducing your days outstanding for where you submitted your claim, now you're waiting to be reimbursed on it, because if the level of accuracy is higher, then the billing process will work much faster. And then one last feature is, we process ICD-9 and we process ICD-10 in its natural state. It isn't a substitution algorithm. We're processing it the same for ICD-9 as we are for ICD-10, and we're one of the only ones that can do that. And thus, ICD-10 is mandated in the United States. It was mandated for October 2013. HHS and CMS are reviewing it, and it's anticipated they'll extend that to October 2014. So right now, our computer-assisted coding tool, using our intelligence that we put into it through our XPatterns, is able to demonstrate your ICD-9 coding that you can use right now and send off to your payer, but also showing you the ICD-10 coding so that it serves as a training mechanism, and you have it up and running a full year before you need it. So you end up with that training, and in doing so, we're also training the medical practitioner on how they prepare their electronic medical record, so that when the transition is mandated, the companies and the entities using our software are ready.
Wow. Wow,
So
that's a
we're
big
kind
achievement.
of thinking ahead.
That's a big achievement right there, rather than
Exactly.
scrambling at the last minute
Exactly.
to get ready.
Get ready, exactly.
Now, I see you have an XPatterns PubMed application. How did those two relate?
So a moment ago, I spoke about the medical researcher. So PubMed is a data set that is put forward by the National Institutes of Health. It comprises approximately 400,000 separate articles drawn from 32 countries' journals. And so it is a very large data set. And the current search engine that is made available for it is what we call a Boolean search. And it's one that everyone is accustomed to using. You put the term you're looking for, and you can put ands and negations and exclusions, etc. What we've done is we've taken that entire corpus, we've indexed it, clustered it, and put it into our relevance engine. So now we have the PubMed domain expert. And what we've done is we've made it available to John Q. Public. It's out there. It's called pubmed.xpatterns.com. Anyone in the world can use it. Anyone can go in. They can put in their query terms. We have faceted capabilities there, so you can look based on year, based on country, based on journal, based on, and continue to revise it. And what we're doing is we're displaying it both in linear format and then in what we call our graphical format, which is a bubbles and sticks, where we're revealing in the center node will be the concept you were searching for, and then it shows you the top 8 that are most relevant. And it's in that area where the term, you'll know what you're looking for when you see it appears. You're looking at that and say, I wouldn't have seen that had I just looked in a linear format, but because I'm looking at the relevance quotient, it appears in. And so this bubbles and sticks is a new way to display our information so that you, the user, be you a researcher or John Q. Public, can make sense of it in a manner in which is helpful to you. You click on the entry and it takes you to that raw, natural state entry, that article that's sitting out there on PubMed. And what we've done is we've highlighted the words inside the document and put a table of descriptors across the top. So this word is associated with a drug, this word is associated with the disease, this word is associated with the author. In that manner, the viewer, the individual using it, can know, this is why this document was deemed relevant.
I can see why you call it intelligent analytics.
Exactly. And so the idea is PubMed is our first step in a very public way to accelerate medical research.
Tell me more about clinical decision support and what that is.
So clinical decision support is medical practitioner facing. Every hospital clinic has a code book that they go by, and that's their, you would call it your level of service that you expect. And this is how you do diagnosis here. And in that guide, every doctor, every nurse, every practitioner in the entity is held to that standard. Measuring that is difficult. And thus, if you create a tool to not only highlight to the medical practitioner at the point of encounter with the patient, this is what's in the code book based on your diagnosis. And also, this is what our medical research community has availed of late, and that can be, of late can be an hour old. And, by the way, this is what is available in the pharmaceutical arena. You can marry all the facets together into one dashboard at the point of encounter. You're empowering that clinician in their decision support. You're not making the decisions for them. What you're doing is you're highlighting, I'm making this decision, and then letting them know it's in variance to the code that's been decided by the hospital. And variance sometimes is absolutely necessary, but just be aware that variance is occurring. So that's clinical decision support.
Very interesting. What is the difference between that, clinical decision support, and clinical analytics support?
So, as I explained, clinical decision support is for the medical practitioner. Clinical analytics support is for the chief medical officer, the chief administrative officer of a medical entity. What it helps you do is it measures the finance side of the equation, always important. It measures the adherence to the book, so it qualifies how many variances have occurred, how many encounters have been in keeping with the documented procedures. It also allows for the general administrative health to be revealed in a manner in which, for example, this department has the following types of patients. They are being treated in the following manner. The analytics we're able to show the efficacy of that because you're marrying together not only the electronic medical record, but also the coding that's taken place. And that's why the computer-assisted coding is what I call the foundational element of these other support tools. It's because it's on the basis of the electronic health records that the entities keep that we can marry together the administrative with the medical, with the managerial, and clinical analytics support. So desperately needed because everyone is using their stovepipe systems. And with XPatterns, we're agnostic to that. We can just layer over the top, marry them together, and generate the reports that give connect, act, because we've already revealed the information to you so that the administrators can have actionable intelligence based on the information gleaned from that they already have. They just need to marry it together.
Do you feel this could ultimately hold down healthcare costs?
We believe that not only will it lower healthcare costs, it will drive efficiencies within healthcare because it will reveal duplicative efforts, and thus just in that one revelation, you're going to have a cost savings. Secondly, we believe that the capabilities, as they are enabled, will change the roles of the medical practitioner, the coder, the administrator, to that, in that they're making great decisions based on knowledge and wisdom and not having to recreate the wheel every time they need a report within their system by marrying these disparate systems together. By laying this overlay there, we're able to create the patterns for them and show them the reports that they desperately need, and they themselves know what they need best. While we may suggest, we have the flexibility to create it a la carte as well.
Wow. Christopher, what would you say is unique about XPatterns?
The most unique factor about XPatterns is that it's data and linguistically agnostic, so it has global application. That's what makes it most unique. Secondly, it is an intelligent semantic platform that has machine learning in it. It gets smarter every time somebody uses it within their domain. That's what makes it truly unique. It wasn't created overnight. This company's been in business for 7 years. We have been evolving XPatterns to the point where it is today. We are able to help all industries. As I said in the beginning, we chose healthcare because we believe that will make the largest impact. The XPatterns platform is only dependent on having data to ingest. And the larger the data set, the more useful the XPatterns is.
How difficult is it to install XPatterns? Hospitals have a lot of different systems.
They do. And hospitals might be one of the more complex, one would think, medical systems, but the enterprises of the Fortune 50 are no less complex. It's easy. And that's the remarkable facet, is that we can just layer over what's already there. We don't require a forklift to use our product. You don't have to take what you have out. We can make what you have better. We can provide lift to everyone. We have a lot of discussions about who's your competitors, who are you cooperating with, and there's this term that's in technology called cooperation, where you compete today, you cooperate tomorrow. The reality is we don't view ourselves as having competitors because those who are also in big data analytics doing similar, but perhaps not exactly what we're doing, can be provided lift by our XPatterns.
Wow. What about cost? How much does this cost?
The cost is very reasonable in the grand scheme of things. We have a licensing fee dependent upon the size of the engagement, and then we go to a transaction fee that is pretty much universal across the board no matter what sector we're in, because what we're really charging for is the utilization of our XPatterns engine that we've invested our 7 years in creating. And so it's a round trip. And we're not talking hundreds of dollars to use this. We're talking a nominal fee for each round trip. And that's the beauty of software as a service, or what we affectionately call cloud, is that the business model is pay as you go. So as you use it, you pay to use it. But instead of us being a cost center, what we really are is a revenue generation engine, because we're bringing, through our revelations of XPatterns, we're bringing new opportunities to whatever entity we're engaged with. We're bringing more efficiencies to a medical community. We're advancing and accelerating the medical research. So we don't view ourselves as a cost center. We view ourselves as a revenue generator engine for companies.
And that's getting me to the next question. What is the relevance of this in the big scheme of things? How does this impact me and the viewers?
Well, in the grand scheme of things, and in a perfect world, XPatterns would be the analytic engine of choice across all industries. We've chosen healthcare for the reasons I stated. Our next entry will be in energy. We believe we have some solutions that can be offered up for smart grid. Then it just cascades: finance, public sector, defense, network security. Any area that has large data sets that are being created today are useful. And some important points. For the first time in history of man and data is the number of big data analysts and the amount of structured data. The analysts are being outpaced by structured data. Marry this to unstructured data, which is growing at a near vertical state. And what we have is this swamped feeling of, I have so much data and I can't deal with it. Because the current engines are designed to deal with structure. We're designed to deal with anything, be it structured or unstructured data. So to make that point, we've made available to the public the PubMed we spoke of. We've also ingested the Wikipedia, all 4 million articles of Wikipedia, and now we reveal it in a manner in which is different than just searching within the Wikipedia. We have put out the United States Patent and Trademark Office, the 2 million plus records that sit within there. You're able now to go in and search within the patent office using our XPatterns, because we've created this domain expert. You can search on a term, smartphone, for example, or you can take a URL from your favorite technical article and drop it in there, and it will show you, based on the content of the article, these are the top 10 or top 50, you set the number of patents that might be applicable to what you're reading about. Or you could take a court proceeding on you're infringing upon my patent, and drop it into the search box, and it will pull up patents that might be relevant to what's going on there. Search by company, search by author. We've created this tool and we're making it available. And then we did a little foray for the average voter. We've brought big data analytics down to the individual level. And for the presidential election of 2012 in the United States, what we've done is we've taken the social network feeds from President Obama and candidate Mitt Romney and their respective parties, and we've put them all together. We've created the domain expert. We've layered over this our XPatterns, and we reveal not only what is each party and each candidate saying about a given topic, and they selected the issues that we preloaded, but you can search on any issue you want. And we display it using what we call as our neural network viewer. And the neural network viewer is a 360-degree display of the data based on the core query. Then it shows the concepts that were drawn from the data itself, and then it connects to, this is what the Republican said, this is what the Democrat said, and it's not remarkable that instead of having a lot of blue and a lot of red, you end up with a lot of purple.
That's funny. That's hilarious.
So we've created something for everybody.
Christopher, we've talked about XPatterns, we've talked about the relevance of XPatterns and the research. How does the average person encounter XPatterns?
Well, good question. XPatterns is designed to be a semantic search platform. And the platform is designed to deal with disparate data sets, and it can be used for industries, enterprises, et cetera. And what we've done is we've created a software development kit. We call it an SDK, where if an enterprise was to use XPatterns, they would create their own applications to run on top of XPatterns that would access their data and reveal the patterns in their data through our engine. And so you wouldn't directly be touching XPatterns as an individual at any time. What you're touching are the applications that run on top of XPatterns. And I spoke of previously the PubMed. So we created an application that we put out on the web so that individuals could research, and it doesn't matter who the individual, all you need is access to the internet. What you're doing is you're accessing an interface, and the interface is going back and working through data using our relevance engine, which is XPatterns. So it's truly transparent to the user because what they're seeing are the applications that run over the top.
So in the case of PubMed, you would go to the PubMed website and look at that?
No, you go to our website, pubmed.xpatterns.com, but in doing so, you would use our application that we created to run over the top of XPatterns. In our clinical decision support, in our clinical analytics support, in our computer-assisted coding. Those are all applications that run on top of the XPatterns engine. Similarly, we created the Wikipedia viewer, we created the USPTO viewer, and then our look into the US elections are all applications that we've created to run on top of XPatterns.
So to go to the Wikipedia XPatterns, I go to Wikipedia.xpatterns.com. Wikipedia.xpatterns.com.
Exactly, and USPTO is patents.xpatterns.com. And in that manner, individuals can use and try it. It costs nothing. It's there gratis. But we're using this as a demonstrative means by which an individual can use an application running on this engine and demonstrate to potential customers that, wow, this publicly available information is here. We can take our own data and create a domain expert using XPatterns, marry the two together, use our software developer kit, our SDK, and create an application that sits on top of it. And we don't need to have professional services involved because every company can do their own analytics. That's the beauty of the XPatterns. It's not labor intensive at all.
So what are your hopes for XPatterns' future then?
Well, XPatterns and Atigeo's future, it is our desire that we will continue in our quest to be a compassionate technology company, bringing science to products and services for a wiser planet. And that's our end state.
Wow. Well, you've made it very clear how helpful this could be right now for the hospitals and the research facilities and medical practices in general. And obviously the future, the sky's the limit. Thank you for being with us. It's amazing.
Well, thank you very much for having us here today.